Welcome to the New Health. As people are getting sicker and sicker at younger and younger ages, we are bringing thought leaders in that are revolutionizing the healthcare industry to make this a healthier planet. I'm your host, Jessica Preston. Today we have with us Dr. Andrew Sun, men's health urologist from Urology Partners of North Texas. Thank you so much for coming and being with us again, Dr. Sun.
Absolutely, thank you.
So last week we talked a bit about how men are coming to see you at younger and younger ages, and I'd love to talk about what the elephant in the room, low T, low testosterone.
Yeah.
So if you could open that conversation for us.
Sure. Yes, probably one of the most common diagnoses that I see. So we'll start with some definitions. So testosterone is a hormone. It is the male hormone, but women also make testosterone. Women make about 10 times less testosterone than men, but in males, testosterone is essentially responsible for all the things that you might think of as male stuff, right? Sex differentiation, muscle mass, hair, voice changes, all of those sort of secondary sexual characteristics, we call it. So when you have low testosterone, then a lot of those things can suffer. But testosterone does even more than just the sexual aspect. It also controls weight and like general metabolism. It controls mood, it controls energy, it controls your ability to think clearly. So when you have low T, that guy can present as someone with sexual dysfunction. It could present as a guy who's just fatigued and tired all the time, no energy. It could present as someone who's unable to have a child, like low sperm counts. It can present as a lot of different things. And so this is a really, really critical hormone. And unfortunately, people have lower and lower levels of it nowadays.
Why?
Because they're not healthy. Yeah, basically.
Yeah, that's
right?
it. It's like, well, the answer is, the question is always why. Why are these things happening at younger and younger ages?
Yeah, there's actually interesting population level data now that shows that over time, average testosterone levels have gone down and down and down. And the thing that it most certainly correlates with is just average health getting worse, right? Because testosterone is naturally synthesized by every guy, and it's usually done so during sleep. And then it's impacted by weight, and it's impacted by exercise, especially large muscle group weight-bearing exercise. And so if you're sedentary, stressed out, don't sleep well, don't do a lot of exercise, of course your T is going to be low.
Okay, so let's talk a little bit about sleep if we can.
Sure.
So it takes, in what stages of sleep, there are different stages of sleep. So there are certain stages, I'm presuming, that testosterone is created?
Yeah, we think it mostly happens in deep sleep. And it is definitely probably the number one overall thing that contributes to low testosterone. In fact, if you had to give a diagnosis for contributing to low T, it's sleep apnea. And a lot of patients have sleep apnea, especially if you're obese and you have sort of a difficult airway. You can have more sleep apnea, then you have low T, then you're more tired, then you don't work out, then you don't, you sleep more. It's just a very vicious cycle, right? And so your testosterone levels vary throughout the day. It's more pronounced in younger men, and as you get older, it's a little bit less, but everybody basically has their highest testosterone levels first thing in the morning, and then over the day it goes down, and then you sleep and it regenerates, and then it goes down, and then it regenerates. So that's why sleep is so important. There was an interesting study done some years ago in a group of college-age kids. They basically took a bunch of kids, put them in a room, and had them sleep 8 hours a night for a week, and then had them sleep 5 hours a night for just a week. And their testosterone went down by like 150, 200 points. Wow. Now, for reference, a normal testosterone range is like 400 to 600. Less than about 300 is low. And so if you go down by 200 points from not sleeping, you can very easily go from normal to not so normal.
So sleep, we're talking about sleep. That makes perfect sense. When you're not sleeping well, then you don't have the energy to exercise, and it ends up being that vicious cycle. And when we don't sleep as well, we also end up with our poor nutrition choices when we're tired. We don't have the healthiest choice in that. So that, I'm presuming you also you had said previously you speak with people about nutrition as well.
Absolutely, yeah. One of my fellowship mentors, Jesse Mills, he basically condensed all of the men's health stuff into 3 things: eat, move, sleep, right? If you can do those 3 things, you're probably going to be pretty healthy. And if you don't, then you're not going to be. So sleep is one. What you eat is who you are, right? It's very, very important. Obesity is a massive cause of low testosterone as well. Some of that is because of decreased production. I can get an interesting explanation, actually. The reason why men have scrotums is because your testicles want to be 2 degrees cooler than the rest of the body, so they hang outside. So when you jump in a cold pool, they try to get warm. When you're out in the sun baking in the heat, they try to loosen up, right? And so if you're especially obese and you basically have a warmer environment, bigger legs, you're sitting all the time, essentially your testicles, which are your testosterone factory, are baking in between there, and they're just not going to work as well, right? And then men also make estrogen. Now, a lot of people think estrogen is bad, and I'm a guy, and I don't want estrogen. You need estrogen, right? You need estrogen for bone health. You need estrogen for sex drive and libido. You need estrogen for a lot of things. You just don't want too much. Too much estrogen in men can cause gynecomastia, or man boobs. It can cause emotional lability and things. And so the thing is, men can't make estrogen by itself. They have to make it from testosterone. So there's an enzyme called aromatase, which takes testosterone and converts it into estrogen. That enzyme is found in fat. And so the more fat tissue you have, the more aromatase you have, the more of your testosterone you basically leach away into estrogen. And we'll see those guys have low testosterone counts, but higher than expected estrogen levels, gynecomastia, these kinds of things.
Now, that's interesting. So what we can see then is one of the reasons why when people are obese, do we just presume when they're obese, they have more estrogen? Do you just look at someone obese and presume there's more estrogen, their testosterone might be a little lower, and then confirm with testing?
Pretty much. I can usually make that assumption. Now, it's obviously not true in everybody. Some people metabolize differently, and different people are going to have different ratios. But in general, if you see a man and he's relatively obese, you can reasonably make an assumption that his estrogen to testosterone ratio will be a little bit off.
Okay, so as you had said, so if you're moving your body, if you're eating healthy, and then you're sleeping well, then that is our best thing that we can do for healthy testosterone levels for men.
Exactly. And the movement part is also, that's the third arm. And it's not just that movement helps you lose weight and therefore you're thinner. It's that the actual act of exercise, particularly weightlifting, particularly large muscle groups like squats and deadlifts and some of these kinds of things, actually seems to help stimulate or improve testosterone production as well, independently of its effect on general health and weight. So eat, move, sleep, and you're good.
I would love to talk to you. You had talked about testosterone range of normal being 400 to 600. You had talked about how these younger men, college students, when they had less sleep, 5 hours a night in that study, that went down 100 to 150 points. Mm-hmm. That's dramatic.
Dramatic.
So when we talk about the opposite end, if they're low, let's talk a little bit about supplementation, how that works.
Sure. Yeah. And one thing to say about the range is that there is a normal range of testosterone, but if you look at the papers on it, it goes from 300 to like 1,000. And so but clearly, you would say, I guess, a guy that's 305 is normal and a guy that's 995 is normal, but these two guys are probably not the same, right? So it's not quite so strict as like, as soon as you cross 300, you become symptomatic. There's definitely a gradient there. Then what can you do about it? So there's essentially two main arms in what you can do. We'll focus on, let's say, testosterone boosting, because what a lot of people probably think of as testosterone is testosterone replacement therapy, but in a way, the healthier thing that you can do first is to try and boost your own testosterone. So going back to the original three things, you can eat better, you can lose weight, you can exercise more, and critically, you can sleep better. If you have sleep apnea, which maybe you don't know, but maybe your partner says, wow, you really snore a lot, or it seems like you're almost choking in the middle of the night, you should probably get a sleep apnea evaluation. And just wearing that mask can boost your testosterone by 100 to 200 points. Right? Weight loss, 10% to 15% body mass loss can increase testosterone 100 to 200 points as well. So you start adding these things up and you can go from very low to very normal very quickly just by doing those things. Now, in addition to those lifestyle things, there are also some medicines that we can use. There is no FDA-approved medication specifically for testosterone boosting, but there are medications that we have used for 50 years that basically do this. I'll talk about two. So there's a medication called Clomid or clomiphene, mostly used in women. What it does is it basically tricks your brain to tell your testicles to make more testosterone. So you have these two brain signals called FSH and LH. FSH makes sperm, LH makes testosterone. Clomid makes you make more of those things, so then you have more signal to tell your testicles, hey guys, make more testosterone and make more sperm. And then when I was talking about that estrogen conversion thing, there's a medication that you can give to block that enzyme. So you prevent that testosterone from being converted to estrogen. You don't want to overuse this, but certainly in the proper doses, you can help to kind of balance those ratios out. And those things will work pretty well.
That's great. So, and then testosterone-wise, there are pellets and creams and...
There's
injections
everything. Yeah, there are more ways to do testosterone than just about anything, right? So you can take a pill, you can do an injection, you can put a pellet in your butt for 3 months, you can rub a cream on every day, you can put like this jelly up your nose. Lots of different ways. Probably the most common ones that you'll see are either testosterone creams. These are every day. They work honestly okay because skin absorption is just not the best. And unfortunately, there is a risk that it can be transmitted onto others if they touch that area. There was an episode of House about this. Injections are probably the most overall commonly used. That's a once a week injection. It is an oil. It's a little hard to inject. You know, that definitely elevates testosterone, but remember, these are all testosterone replacement therapies. So when you're taking things like injections, you actually stop making your own testosterone. And when you stop making your own testosterone, you also stop making sperm. So a lot of guys who are exploring TRT, especially when they're young, they're not really notified of all of these potential side effects like sperm and that kind of thing. And we could talk for a long time about those. And then the most recent one that's interesting is the pills. Pills are easy to take. I like using those a lot because they're relatively easy and they don't seem to have nearly as many side effects as some of the other versions of testosterone.
Oh, that's great. That was a great recap and review. So remember, we're going to be doing our healthy things first for ourselves to be able to improve testosterone count, and then look at either something like clomiphene where we can make more. We can make more testosterone. Is that with assistance? I suppose it's not exactly naturally.
Yeah.
And then in addition, we could look at replacement, but not in the case of when you are trying to have a baby or improve your actual sperm count.
Yeah, correct.
Yeah.
Yeah.
So if you're seeing people are coming in younger and younger for those as well.
Yeah, I think advertising is big, and so a lot of younger men come in with low T, and oftentimes they don't actually have numerically low T. They may have some of those symptoms. In general, the younger the guy is, the higher his baseline testosterone is, the more I will recommend a boosting strategy like the clomiphene or an astrazole or these kinds of things. If they're older, if they have lower starting testosterones, essentially if they're not producing very much, then by replacing their testosterone, they don't have much to lose. So I'll more likely give those guys replacement therapy, pills, injections, things like that, pellets.
Okay.
Yeah.
All right. Do you find partners are bringing people in?
I do sometimes. Definitely on the fertility aspect, I think a lot, right? That's usually, unfortunately, women carry most of the burden of fertility. And, it's usually they will start the process and then only later on does the guy come in. But a lot of times, yes, the partners will bring in is like, he's just cranky all the time, or he's just so low energy, Although I will say on the low T aspect, many men do find their way in themselves because of even popular culture and people know about this.
Oh, that's wonderful. I'm glad that men are being proactive in doing so.
Yeah.
Thank you so much for being with us again, Dr. Sun.
Yeah.
Would you please let everyone know how they can reach you and what you're working on right now?
Sure. So my practice is called Urology Partners of North Texas. We're in 7 locations in the DFW area. Our website is UPNT, urologypartnersnorthtexas.com. You can find us there. Happy to see anybody in clinic or virtually throughout the state of Texas. And, what are we working on right now? Well, there's a lot of interesting new developments in the testosterone space. I think some of the newer testosterone products like the orals seem to show some promise that you can actually give replacement without necessarily shutting down fertility and that kind of thing. So I'm working on a few studies towards that aspect as well.
Oh, that's really exciting. I can't wait to hear more about that.
Yeah.
Well, thank you again.
Thank you.
Please stay tuned after these messages for our next guest.